The pandemic has definitely affected the dental sector because we are more exposed to the oral cavity, the face area, we are so close to the patient, and it's very difficult for us to maintain social distancing. Even with all the protective gear, that is the mask, the face shield, the PPE kit, there are chances that we will ourselves get infected and act as carriers to other patients who also visit us. The awareness among a lot of patients regarding the dental treatment and the pandemic has created a lot of inhibition among patients to visit a dentist.
I'm Dr. Deepak. Most of my schooling was done at Mysore, at Karkala, and finally at Manipal, where I did my dentistry. I did my bachelor's in the year 91 and post-graduation in the year 1993. The specialty is on conservative dentistry and endodontics. And post-93, I've been here in Bangalore for around about close to 28 years now. So practicing in some of the clinics at Richmond Circle, Residency Road, and Gandhi Bazaar as a consultant. It was only the year 2000 I started my clinic here at Indiranagar, Bangalore, and which is where it is called as Millennium Dentistry. Ever since the lockdown got lifted, at least around about half a dozen of my patients who have been treating, they're all 75, 80 plus. Extensive work has been done in the last at least 6, 7, 8 months. So they've all been coming for multiple visits, maybe around about dozen root canals, around about 2 dozen, the crowns. None of these patients who have visited me so far have ever come back and said that we have been tested positive. The biggest concern that we had in the dental clinic is basically the aerosol. The moment we start using a drill, there's a lot of water spray that comes out. Now this spray is literally coming from the patient's mouth out. Now what if the patient is positive? So obviously with the positive, yes, the entire environment is going to be with the aerosol spray which is contaminated with the coronavirus. Luckily that has been taken care by the Shycocan. In the last many months, whether it be my staff or myself, we have undergone several tests. I think none of them have been tested positive. So I think we've been sort of protected with the devices that we have here in the clinic. Ever since I've got this unit installed in my clinic, the other clinics that I visit, I made it a point to install there as well. Of course, I've been working as one of the senior consultant in the field of endodontics. We see around about at least 40-50 patients minimum. I'm talking, during the COVID time. The overall staff strength is around 40-50, you can put it. And the patients, of course, at any given time is around about 50 to 70 patients in a day. I think there, I would say, in my experience, none of the doctors have been tested positive. So that's a real positive sign. And the staff who have been working there. So even if they go out and even if they contact the virus and if they come back and start working in the clinic, of course, without their knowledge, this particular unit, Shycocan, will prevent the spread from one patient to another patient, one individual to another individual. In that context, yes, it is something that I would strongly recommend. For a patient to understand the working of this is very difficult. Secondly, there's a lot of fear. Of course, everyone sort of fears to their life. End of the day, their trust is on the dentist, on the doctor whom they're working with. Today, of course, they said, Dr. Deepak, that clinic, absolutely fine. He has got the devices which is sort of working. And they've been, psychologically, morally, or even otherwise, they've been quite comfortable.
Shycocan. Let's bring life back to normal and normal back to business.